Good morning. This is Courtney and Olivia with your morning news.
Today we have a story of a family near and dear to our community. The Jamison family opens up and tells about how baby Amber survived the battle of cancer.
Amber was diagnosed with neuroblastoma at the young age of 6 months.
Now let's take a look into the life of Amber Jamison. Check this out.
Mrs. Jamison, would you like to describe to us the struggle of Amber's cancer?
Well, when Amber was born, we noticed that she wasn't that hungry. She would gain weight, but we didn't really know why she wasn't wanting to eat. So we took her into the doctors and we found out that there was a tumor that was in her abdominals that was causing this lack of appetite.
Wow. Were there any symptoms that you noticed?
We noticed that she would get a lot of fevers and like constipation and discomfort, but after the doctors told us that all this was associated with the tumor that was in her abdominals.
Oh, wow.
So we never really expected it. There was no trace of it in our family's history, but the good news is that this isn't an inherited cancer, so Amber's kids will not have to deal with it.
Oh, that's good. Do you know, where did it really start, the cancer?
Well, the doctor said that neuroblastoma was a result of the mutation of the ALK and PHOX2B gene, which are really just used to code proteins and copy our DNA.
Wow. And what were the next steps once you figured out that it was neuroblastoma?
The doctors had encouraged us to approach it surgically from removing the tumor because they believed that it was caught early enough that it hadn't spread yet. They had a feeling that Amber would survive without radiation because she was diagnosed only with stage 1. Even though there aren't many side effects, because of the surgery, we do run a risk of Amber still having hints of neuroblastoma left in her, which can spread at any point. But we still go in for checkups and tests. We had the opportunity to try many clinical studies, including testing of antibodies along with chemo could be used to kill the cancer cells, or using a low but continual dosage of radiation. We still have the opportunity to participate in a trial using specific antibodies to kill relapsed cancer cells also. So,
wow.
Yeah. We never thought it would happen to our baby. Nobody ever does. But all I can say is we're blessed to see her fight through this battle and survive.
That's really great. Thank you.
You're welcome.
Wow, that just breaks my heart. It is so devastating to see such little kids deal with such pain.
Cancer is so overwhelming and traumatic. It perplexes so many people. Olivia, don't you have some facts about cancer for us today?
I certainly do. Cancer is the uncontrollable growth and division of abnormal cells. Cancer formation starts when a part of the gene has a mutation, but the cell disregards it and continues to divide and reproduce. It causes individuals to rapidly produce the wrong cell, therefore making them ill. Genes that encourage cancer cells to divide are known as oncogenes, known prior to cancer cell reproduction as proto-oncogenes. On the other hand, tumor suppression genes encourage cells to stop reproducing.
As of now, there aren't any specific carcinogens that lead to neuroblastoma. However, doctors are intensively researching to find out more about cancer.
Now let's talk to an expert to truly understand neuroblastoma. Hi, my name's Dr. Helen, and I have a few facts for you about neuroblastoma and cancer in general. So, today we're going to be looking at our patient, Amber Jamison, who was diagnosed with stage 1 neuroblastoma cancer, which caused her body to form a tumor, which may have been a response to oncogenic RNAs, as we see right here on the chart of cancer cells. Neuroblastoma is a solid tumor arising from the developing sympathetic nervous system. Hallmarks of cancer in general and the characteristics of cancer are as follows. Cancer cells stimulate their own growth. They resist signals to stop the process. They continue to grow. They have their own
death cycle. They don't respond. They also stimulate growth in blood vessels, so the nutrients isn't able to be spread to the rest of the body. They also multiply forever. And they also invade neighboring tissues, which allow the cancer to spread. In addition, there's the changes of cells that happen as they become cancerous, and there's the cytoskeleton change that causes them to interact with their neighboring cells and allows them to move more freely, creating that interaction and attachment. Also, they can reproduce when there's still cells near them, so they continually reproduce without anything inhibiting them. Also, you see their nuclear changes, and their nuclei becomes larger, and it acts differently than usual. Lastly, we have the enzyme production, which allows cancer cells to invade their neighboring tissues, causing the spread of cancer. Now let's address baby Amber Jamieson's cancer, neuroblastoma, specifically. This cancer forms from immature nerve cells, usually found in the adrenal glands. These cells are supposed to mature and function, but instead they become cancerous cells. They usually start in the nerve tissues right above the kidney, but they also can be found in different places, like on your neck, in your chest, by your pelvis, and quite a few other places. They can even spread to your bones, or your skin, or your liver, depending on your stage of cancer and everything. So in each location, there's different symptoms and there's different causes. So when you have it in your abdomen, you have swelling of the abs, but when you have it in your chest, it can actually cause a difficulty of breathing. Whereas if you have it in your neck, it can even cause Horner's syndrome, which causes you to have droopy eyelids, red skin, you sweat less, and it causes several other things, and it damages the nerves in your neck. Also, you can even have it in your bone, which cause pale skin, bruising and pain of your bones, which cause many different things as you grow. Also, you can have it in your backbone, which actually compresses your spinal cord, giving you weakness, numbness, and even can paralyze your lower body. And when you have it on your skin, it can cause rashes, and you get pimples almost that look like blueberries, which is very interesting. In rare cases, neuroblastoma will release hormones and cause high blood pressure, your heart rate will increase, and you'll have flushed skin, and cause opsoclosis neurosis syndrome, which also can lead to some jerky muscle movements and eye movements. A good thing about having neuroblastoma is you can't really pass it down to your offspring. It's non-hereditary, and it's slightly more common in boys. Now, the prognosis for neuroblastoma, it kind of depends, and many children with neuroblastoma have a good chance of surviving. In general, neuroblastoma is one of the more favorable outcomes of cancers. However, high-risk neuroblastoma is harder to cure, so you have to just go to your doctor and see what stage you have of neuroblastoma to see how to treat it and how to respond to it. But any stage, specifically higher risk, you have the chance of it coming back after your treatment. To diagnose neuroblastoma, we first consult geneticists who use a DNA microarray to analyze the ALK and the PHOX 2B gene. And based on that, they're able to tell us what stage you have and if you have it even. The only way to really tell is by using geneticists to confirm that this is the cancer you have. Pathologists review, we give tissues for pathologists to review, and they sample them as we see in this picture, and they scan them and dye them to see the different coloring. And the darker spots here, as you can see, are the nuclei, and you can tell that they are spreading and renewing really fast. There are 3 main stages. There's low risk, intermediate, and high risk. Depending on the stage, the diagnosis will be determined. Sometimes when you have low risk, doctors will even try to wait it out because sometimes it disappears on its own. However, if it's higher than that, we usually don't do watchful waiting. We actually take action. So our common treatments are, first of all, surgery to remove the tumor, as we see here, what we did in Amber. This is Amber when she had the tumor. You can tell her abdomen is swelled. So then we remove the tumor. However, if the cancer has spread and it's a higher stage, then we also add in possibly radiation therapy or chemotherapy, which kills the actively dividing cells. And if it continues, we'll even try other treatments like retinoid therapy, which sustains chemically related vitamin A cells, and it encourages the cells to turn into the mature version of the cells instead of cancerous cells. Even we have some newer treatments, which are tumor vaccines and quite a few other more specialized treatments. And that is how we cure neuroblastoma. I hope you...
Well, there you have it, neuroblastoma.
I must say that is interesting but horrific at the same time.
So true. Well, that's all the time we have for today.
Have a nice day, and don't forget to tune in to this show tomorrow.